Okay, so we're going to continue on with talking about some of our median nerve issues. Last time I talked about how we treat it in the office. Obviously, we don't stop there. We want to make sure that the patients have something to take with them when they leave. A couple of things that we do consider, and I've talked about this before, but overall, posture is really important for this. So sometimes when we target this, that might be where we start. We just might have to discuss some things that can help them from that, whether it's some area of strengthening, it might be some stretching that they're doing. Some other things to consider too is if they have, maybe it's something job related or workout wise, if they're doing something to continue to irritate that, obviously we want to get that cleaned up as well. With the median nerve specifically, if we are suspecting that it is coming from the carpal tunnel, a lot of times we will have to give a splint to be able to wear at night. Essentially what it does is it just leaves a little bit of extension in that wrist, and that helps open up that carpal tunnel. Sometimes that is necessary. More specifically, some of the other areas that we treat, again, diagnosis is really important for this. So we need to know where the irritation is, where the compression is, and to be able to help us develop something to be able to give to that patient. So we talked about some of the stretching, we talked about the strengthening. Something else that we might give to the patient is what's called nerve flossing. Okay, so I'm actually going to do an example of that with Sarah here. So let's have you slide down to this edge, still facing that way. So when the median nerve's involved, we can actually have her do some mobility at home. Okay, so we compare this to like flossing your teeth, but we're actually flossing that nerve along its track there to make sure it has as much freedom. So Sarah, what I'm going to have you do is turn your head to the right, and then she's going to take a big extension at the wrist there. Good. And then she's going to relax these two joints here, and then she's going to look towards the opposite way. So go ahead and repeat that again for me. Good. Other way. Perfect. Good. Again. That's perfect. So that's what a median nerve floss looks like. And if we're on the right path with this, we'll have the patient repeat this 10 to 20 times. We might have them do it 3 to 4 times a day, and sometimes that is necessary to be able to resolve an issue like this. So, okay, that's it for today, guys. Thanks for watching. Appreciate it.